Greetings, Eric Backer, naturopath from New Zealand, author of Candida Crusher and formulator of the CanXida range of products. Thanks for coming back. We're talking about autoimmunity. We're going to talk about rheumatoid arthritis as being one of our first topics of autoimmune discussion. I've been treating RA patients now for as long as I can remember, probably close on 30 years. There's osteoarthritis, the wear and tear arthritis, and there's rheumatoid arthritis, the autoimmune arthritis. A big difference between them both. Osteoarthritis can affect males and females. Rheumatoid arthritis predominantly affects females, I'd say 90%. So this is a condition that often runs in families. There's a strong genetic component to it, and there's usually a trigger, one or multiple triggers. So I'm just trying to remember now what the particular marker is. I think it's a HLA marker. HLA-DR1 to 4 is a genetic marker. So HLA-DR1. So there are different kinds of markers or genetic predispositions we find in particular diseases, and this is a HLA one. So the medical treatment is primarily aimed at reducing the inflammatory markers. So drugs are given often. They can be older type drugs or newer type drugs that they use now. Some drugs they use now, for example, are aimed at blocking an inflammatory marker made by the white blood cells called tumor necrosis factor. So the TNF drugs, the TNF alpha blockers, are often used now with great effect. But the problem is the side effects include cancer, diseases like that, or opportunistic infections. And many times I've seen people on TNF blockers that end up with bad Candida infections. So Candida is actually an opportunistic infection that's actually linked with rheumatoid arthritis. Proteus mirabilis is a bacteria that many times I've found in stool test results underpinning RA being rheumatoid arthritis. But it's also linked with Lyme's disease and Yersinia and Clostridia and Strep and Staph and Candida albicans. And many different types of opportunistic bugs can be there in the gut. Get in there with leaky gut, and when the person's got the particular gene susceptibility, bang, it's almost like trying to catch a fish. That pathogen causes the inflammatory response, and the genetic predisposition is there, and bang, off it goes. They set up this inflammatory cascade, and then it will start affecting the small joints of the body, causing all this immune dysfunction that they have. And then all the patient's interested in doing is switching off that pain, that awful inflammatory pain. Many times I've seen rheumatoid arthritis, I've tried to look for the hidden infection, and I've in many cases found it in terms of Candida or something like Lyme disease, or there'll be some kind of marker there that we can actually find. So then we try and reduce that population. We try and shut the door of the leaky gut. We try and get rid of the fungal problem. We try and change the diet. We try and modify the patient's lifestyle. We try and improve their adrenal function, because this is going to give the patient the ability to reduce their own inflammation by default, naturally. Many people with RA get very stressed. Excuse me, they get stressed because they're in a lot of pain. They take a lot of medications, and these can be drugs like methotrexate, for example, which is like a chemotherapy kind of a drug. I'm just trying to remember the other one now. There's a malarial kind of a drug that they take there as well. Forget the name of it now. Plaquenil. So Plaquenil is a drug used to treat malaria of all things, and it can really mess up the eyes of the patient and the liver and other organs. And this drug was often used for RA. The patient gets dizzy, they get sick, they get weak, they feel like vomiting half the time, they feel sick. But these drugs are given by the rheumatologist to sort of treat rheumatoid arthritis. But in the end, the side effects are so severe that nobody stays on Plaquenil or methotrexate. They get off these drugs. Then they move on to the DMARD drugs, or the disease-modifying anti-rheumatic drugs. And these can involve things like the TNF alpha blockers or many other drugs that are being developed right now. So what the hell do you do if you got rheumatoid arthritis? Have I got the solution? I don't know if I've got a solution, or I don't never use the C word, the cure word, but what I can tell you is I can help people with rheumatoid arthritis significantly by helping first them to understand they need to reduce the need for taking drugs on a long-term basis. Short-term medications I think are quite effective, but long-term it's a no-brainer. You can't stay on powerful drugs long-term any more than you can stay on an American Express card at a 25% interest rate for too long. It's going to fry you up. You can't do it. Unless you're Donald Trump. I always bring Donald Trump into these discussions. So you know what I mean? So you need to think carefully. The more powerful the medication, i.e. the higher the interest rate, the less likely you can really remain on this kind of treatment. So it's really a balance between, pain relief, and side effect. So I'm not against drugs. I'm against drugs that create serious sickness and side effect in their own right. Fish oils, anti-inflammatory by nature. Omega-3, start on 1 gram, move up to 3 grams per day. Turmeric, so a very good curcumin extract has proven to have very good anti-inflammatory action. And in fact, it works on TNF. So it is an anti-TNF in its own right. So I think it's called the BCM95 turmeric extract. So you can get good high-grade turmeric extracts today that have a very good anti-inflammatory effect. Here's a tip for you. 1 teaspoon of turmeric powder, mix it with a bit of coconut oil on a Monday. On the Tuesday, 1 teaspoon of ginger powder, mix it in a little bit of coconut oil. On the Wednesday, go back to the turmeric. On the Thursday, go back to the ginger. So alternate turmeric and ginger every 24 to 48 hours and watch what happens in 2 to 3 weeks. You could get a bit farty or bloaty for a week or two. Back off the dosages, but you'll find that in time, that particular protocol alongside fish oil is going to give you a good anti-inflammatory effect. All right? But don't tell too many people, because it might mean a drop in sales, because I think TNF blockers in 2009 alone was something like $22 billion worldwide. God knows what it is now, it'd be up around the trillions of dollars. So there's no money in turmeric, there's no money in ginger for companies, there's a lot of money in peddling drugs that have powerful effects. So think about that, think about what we spoke about, reducing your need for these powerful drugs, understanding the connection between the adrenals and a good cortisol response, and producing the body's own ability to reduce inflammation, shutting the door on leaky gut, identifying Candida or SIBO or underlying gut issues and cleansing them, restoring them. Check out the CanXida products I've made because they have a nice effect on cleaning up Candida and many different types of imbalanced strep and staph in the gut, parasites. It's going to help to clean that gut right up. So a clean gut is a very good start in your quest to helping reducing the need for strong medication. Changing the way you eat, changing your lifestyle. I've done many videos on this topic. So if you're new to this channel, please check out some of my videos on stress, adrenal fatigue, leaky gut. There's hundreds of videos on this. So if you've got RA and you're watching this right now, I want you to know that you can make a big difference in the amount of pain you experience over time. But the sooner you get onto it, the better. There's no point trying to work on rheumatoid arthritis when you've got crippling, gnarly fingers. You can't even undo the lid off a jam jar. You shouldn't be eating jam anyway, what I'm saying. Undo the lid off a yogurt jar, okay? So if you've got a huge amount of disfiguration already in the joints, it's probably going to be too late for you. But if you're just starting out and you're a young lady watching this video, I hope it'll be an inspiration to you to let you know that you can make a big difference with rheumatoid if you get onto it early enough. So I hope that gives you a bit of an insight, okay? I've helped a lot of people with RA and I've seen many people get benefit when they got onto it sooner rather than later. And that's it for this video. Thanks for tuning in. Click on the link below if you haven't got my free Candida report. Otherwise, I'll see you in the next video. Thank you.